Hi everyone, Dr. Campbell here, and in this video I would like to walk you through the 10,000 series of the surgery section for our 2020 CPT code set. Now, the 10,000 series is actually at the very beginning of the surgery section, and I think it's appropriate for us to just really start at the very beginning with a couple of reminders. All right, so I'm going to go ahead and pan down to the book. And so, as you've learned in previous videos, each section starts off with a table of contents. It also starts off with guidelines. The guidelines are always going to be the green pages that are at the very beginning of a section, and one of the things that I highly recommend that you do is get in the habit of every time you start a new section of CPT that you remember to start with the guidelines. All right, so I'm going to go past the guidelines, and here we have the table of contents for the 10,000 series. And the 10,000 series starts off with our general codes, which are for our fine needle aspiration. And then after that, we have all of our codes for the integumentary system. So let's go ahead and start with fine needle aspiration. So as it relates to the fine needle aspiration, one of the things that I want you to really remember that there are guidelines at the very beginning of the fine needle aspiration. And in those guidelines, it is noted that a fine needle aspiration, also known as a FNA biopsy, is performed when material is aspirated with a fine needle, and then those cells are examined cytologically. Whereas a core needle biopsy is typically performed with a larger bore needle to obtain a core sample of tissue, and this is for histopathologic tissue. So notice the difference in the terminology. Now, as it relates to our FNN codes, they are divided based upon whether or not image guidance is utilized. So let's take a look at some of the codes. So I'm on page 77 in our 2020 CPT manual, and you'll notice that the first two codes, 121 and 104, those are for fine needle aspiration without imaging guidance. You will also notice that the first code is for the first lesion, and the second code, which is an add-on code, is for each additional lesion. Then the remaining codes in this particular code family, what you'll want to note, and as I've mentioned before, as you're going through a new section, it might be a good idea to put bubbles around your families of codes. So the next two codes, 100.05 and 06, it's for a fine needle aspiration, but it's including ultrasound guidance. And notice how in my manual I have ultrasound highlighted to remind myself that this code family is for ultrasound. Now again, you may want to do the bubbling process for your manual. It's really up to you if you think that that is a good approach. Think about it earlier in your CPT coding process, because you may find that when it's time to take the exam, You don't want to have to spend days or weeks working on that. All right, and then immediately after that, we have codes for fine needle aspiration, but instead what you'll want to notice is that these codes are for fluoroscopic guidance and the same setup. The first code is for the first lesion, and then the add-on code is for each additional lesion. Turning over to page 78, what we have is fine needle aspiration with CT guidance and MR guidance. Now again, in addition to reading the guidelines in front of the section, the guidelines that are in the subsection notes that precede a particular section, don't forget about your parenthetical notes. National exams are notorious for trying to see if you pay attention to the subsection notes or the parenthetical notes. All right, so now we're going to go on over to the integumentary system. And the integumentary system is going to consist of procedures that are done on the skin, hair, and nails. And we're going to first start off with codes 130 and 135 to 36. So 130 is going to be for image guided fluid collection by a drainage catheter. Now, what you'll want to note in our CPT manual, this is the only code in this particular family, but this code does have a few parenthetical notes that you'll want to pay close attention to. And then immediately after that, we have two codes for placement of a soft tissue localization device. And what you'll want to notice here, these codes do include image guidance, and they are also divided by the first lesion and then each additional lesion. Now, we've seen that a couple of times with our codes, but we don't want to get complacent and think that that is the process that you're going to see for all of the codes in the family. Okay, in this section, you want to take each code family independently so that you don't make the mistake of applying skills to something that doesn't actually apply. All right, so the next thing we're going to go to is our incision and drainage codes. We're still on page 78 in our 2020 CPT manual. And incision and drainage, as you probably already know, means that they're making an incision to establish a pathway to drain fluids from different sites of infection. So in our CPT manual, on page 78, I want you to notice the different incision and drainage codes that we have available. So we start off with 140, which is for acne surgery. Then we get into 160 and 161, which focus on incision and drainage of an abscess. But what you'll want to note here is that 160 is for a simple incision and drainage or single, whereas 161 is for complicated or multiple. Immediately following that, we have codes for IND. That's what incision and drainage is abbreviated as. And here, it's an IND of a pilonidal cyst. Now, I know I keep emphasizing this, but I want to show you an example of how not following the structure of the manual will lead to coding errors. You always read your parenthetical notes. And what you'll notice here on page 78 at the bottom is that if the patient has an excision of a pilonidal cyst, you want to use codes 11770 through 11772 because that is for an excision. So if your patient has an incision in drainage, you want to do the codes that are over here. So again, very important to pay attention to what you're seeing in the manual. Then over on the top of page 79, we have incision and removal of foreign body subcutaneous tissue. So notice I have foreign body highlighted here because that's something that is important that I want to pay attention to. Then the first code is for simple, the second code is for complicated, and then the next single code, 10140, is for incision and drainage, and I'm going to highlight this here, is for hematoma, seroma, or fluid collection. Then after that, we have a puncture aspiration. So I'm going to highlight puncture aspiration because that's a little different than the previous code, and it includes abscess, hematoma, bulla, or cyst. And so I just want to make sure I'm differentiating between those two codes. Then I have 10180, which is an incision and drainage, but this is for a complex post-operative wound. Of note, there is a parenthetical note that lets us know that if the patient is having a secondary closure of a surgical wound, you are being referred to another code family. So just like other code systems that you've worked with, attention to detail is going to be critical. All right, so we're going to go on over to our next family of codes. And here in our next family of codes, we have debridement. And I'm pretty sure that when you took medical terminology or anatomy, you learned that debridement is a process of where the provider is actually cleaning out an area. So with debridement, I do want you to know that here it is very important to notate in the medical record the depth of the tissue that is being removed and the surface area of the wound. So immediately that's something that you want to zero in on when you're reading the documentation so that when it's time for you to select your code, you are going to you're going to be aware of the information that's needed for proper code assignment. All right, so let's go and take a look at this code family in our CPT manual. So we're on page 79. This is code family 11042 through 11047. So first up, we have codes. Oh, look, guys, a coding tip. So remember the 4 types of guidelines: the guidelines in front of the section, the subsection notes, the parenthetical notes, and then the coding tip. So our first 2 codes are debridement, but they focus on extensive or eczematous or infected skin. Now what you'll want to notice about the first code is that it is for up to 10% of the body surface, whereas the add-on code says each additional 10% or part thereof. Now this concept here, or part thereof, is very important because what this means, anything above 10, 12, 14, 20, 30, you're going to use this add-on code to reflect anything above 10. But when they say or part thereof, you could have 5% additional. But in order to get 10 plus 5, you have to use this add-on code. Now, remember, add-on codes cannot be used alone, and they must be used in conjunction with the primary code. From there, we have code family 11004 through 11006. And notice I'm putting a little box around mine. And what you'll want to notice here, this is for debridement, skin, subcutaneous tissue, muscle, fascia. But for here, we're looking at necrotizing soft tissue infection. And then what you'll also want to notice between these three codes is that they're divided by the body site. All right, after that, we have an add-on code 11008, and this is for the removal of mesh or prosthetic material. This is an add-on code, so as you know, it can't be used alone. Then after that, we have another code family that starts on the bottom of page 79, but it continues over onto the next page. So let's see what this family is about. It is debridement, but notice it is including removal of foreign material at the site of open fracture and or dislocation. This code here says skin and subcutaneous tissues. And we're going to turn over to the next family, or the next code in this family. And notice the second code is skin, subcutaneous tissue, muscle, fascia. So notice, and muscle. So notice we're going deeper. Whereas 11012 is all the way down to the bone. So again, with debridement, you always want to be thinking in the back of your mind, how deep was debridement? Then the last codes in this particular area start with code 11042, ends at 11047. And what we have here is just plain old debridement. These codes are divided by square centimeters. And again, each code family has to stand alone in terms of what it requires. So this is coded by square centimeters. Now, notice it says first 20 square centimeters or less. So when you go above 20, you have to use the add-on code. And what do you see in the description of the add-on code? Each additional 20 square centimeters or part thereof. So again, if you had 28, you would list 11042 and then 11045 for that additional if it was on subcutaneous tissue. Now, so those two codes go together. Then the next two codes that we have, 11043 and 11046, and what you'll want to note with those two is that the debridement is deeper. So notice it says muscle and or fascia. Okay, still divided by the square centimeters. Then the last two codes in this family, we have 11044 and 11047, and they're all the way down to the bone. All right, so for debridement, we want to make sure, and this actually says it here in our CPT manual, that our debridement codes are reported by the depth of the tissue that is removed and by the surface area of the wound. All right, so we're going to go over to our next code family. And from debridement, we're going to go over to paring or cutting. So this is going to take us over to page 80. And paring or cutting, think about when you have a pair. Sometimes you may pair that item. So paring or cutting is really where the doctor is removing corns or calluses, and those are just some examples, but they're paring it, okay? This procedure typically may require local anesthesia, but not that often, as you can see from the diagram. So let's take a look at the codes that are in this family. And so we're on the bottom of page 80. And here we have 3 paring or cutting codes. And you'll notice that they're divided based upon the number of lesions. All right, the next code family that we have are the biopsies. Now, I know you may be thinking, well, wait a minute, didn't we just see biopsies? Those were fine needle aspiration. Okay, very important. So, a biopsy is where the doctor is removing tissue for purposes of examining that tissue to come up with a diagnosis. And or they can even be looking at how extensive a particular disease is. So the one thing that you'll want to note is that these codes per the subsection notes are for diagnostic histopathologic examination. And this is a procedure that was done independently or unrelated or distinct from any other procedures or services at the same time. There are some additional notes there. I know that you know by now that you need to read them. And so let's just go ahead and take a look at the codes. The other thing that you'll want to know about the biopsy codes is that we do have different types of biopsies. And so you'll notice in my book that I actually have them highlighted. So we have a tangential biopsy. We have a punch biopsy. We have an incisional biopsy. Now, notice all of these notes here, guys, on page 81. I know I said this before, but I'm going to say it again. It is critical that when you're learning a particular section that you go ahead and read the notes then, because trying to read them right before an exam is too stressful. So, as it relates to the codes, they are divided based upon the type of biopsy, tangential, punch, or incisional. And what you'll notice in terms of the codes that we have available, the standalone code is for the single lesion, and then the add-on code is for each additional lesion. And again, notice just the simple notations that I'm making in my book. One of the things that you want to be very careful about is that you don't want to have so many notes in your manual that you get overwhelmed and confused. So just very simple, subtle notes, in my opinion, actually are better than a bunch of extensive notes all over the place. You know, some things you just got to remember. All right, next up, we're going to go over to our next code family, which are our skin tags. And you probably have skin tags or know someone that actually has skin tags. Not a lot of codes here. These codes are on page 83. And on page 83, what you'll notice about these codes is that they're divided based upon the number of lesions. So the first code, 11200, is for including and up to 15 lesions. And then that add-on code, and there's our friend again, each additional 10 or part thereof. So if you had 32 skin tags removed, 11200 would get you your 15 lesions. But wait a minute, you're like, wait a minute, I got 32. So that mathematically, how do I get to 32? So 11201 is your add-on code that gives you 10. Okay, so now where are we at? We're at 25, which means we need another add-on code to get the additional ones. All right, let's move on to our next code family. And our next code family is going to be on shaving. So shaving is actually horizontal slicing that is designed to remove epidermal or dermal lesions. All right. So here our code family is starting on page 83. And what you're going to notice again in my particular manual, I'm making some notations to help me quickly navigate. Don't forget to read the notes again. Better to read them now while you're learning CPT as opposed to right before a big national exam. So the one thing that you'll want to know about the shaving codes is that the primary division of these codes are by body site. Okay, so 11300 is for trunk, arms, legs, whereas 11305 is for scalp, neck, hands, feet, genitalia. Then if you turn over to the next page, what you're going to notice, this code here is for face, ears, eyelid, nose, lips, mucous membrane. So again, primary division is going to be by body part. Once you identify your body part, then you need to know about the excised diameter of the lesion. The other thing that you'll want to take note of is that these codes are for a lesion. So that's one lesion. So if you have multiple lesions, you're going to have more than one code. All right. So we're done with our shaving. And our next code family, this is one that we're going to take a little time looking at this because there's a lot of key things that you need to know, and it's for our excision of lesions. So here, the first thing I want to go over is kind of like the things that you need to know when you are looking in your documentation and trying to decide if you're going to code an excision of a lesion. So number one, the codes that we have available are divided into excision of benign lesions and excision of malignant lesions. So you have to know the type of lesion. I find it very helpful that when you have a lesion, if you're not sure if the type is benign or malignant, just Google that lesion so that you know what you're dealing with. All right, so as it relates to the benign codes, they actually start on page 84, and they start with some, of course, subsection notes. And we're going to pan over to the codes themselves, and I want you to notice that once again, I have some things highlighted for myself. So after you know if something is benign or malignant, the next thing you need to know is the actual body part that the lesion was excised from. So after you determine your body part, and again, notice I have specific families highlighted: trunk, arms, legs, over here, scalp, neck, hands, feet, genitalia, and then a little bit further down, I have face, ears, eyelids. And notice this says excision of a lesion except skin tag. So you got to pay attention to the little details. So then after that, you just have to know the size of the lesion. I want you to also note here that it does say lesion, so it's one lesion. That is the value of that code. Now, there are some other things that you need to know, and those are related to what type of closure is performed for the excision. Simple closure is actually included in the excision of a lesion. And you're probably wondering, well, how did you know that? Well, I'm glad you asked me, because in the code manual, and I'm going to keep referring to this over and over and over again, in the code manual, it states that excision is defined as full thickness, removal of a lesion, including margins, and includes simple non-layered closure when performed. It also goes on to further state that we are to report separately each benign lesion that's excised, and very, very important as our next part here is that code selection is determined by the greatest clinical diameter of a lesion plus the margins. Now, this is the part here that I think everybody really kind of, it's a little difficult to understand. What do you mean? Code selection is determined by the greatest clinical diameter of a lesion plus the margins? Well, CPT knew that we all would have that question, and so in the manual itself, we actually have a few examples with a diagram. So in the first example, we have a malignant lesion on the back, 1 centimeters, and that was the excised diameter. The physician also took out margins, 2.0 from the top and 2.0 from the bottom. So remember, guidelines state, and let's get our highlighter out because I think this is important. So code selection is determined by measuring the greatest clinical diameter of the lesion plus the margins. So in this particular example, we take the excised diameter of the lesion, which is 1.0. We add the top margin, 2.0, that gives us 3.0. And then we add the bottom, which gives us a total of 5. So the code we would select would be 5. Why? Code selection is determined by the greatest clinical diameter of the lesion plus margin. I keep saying greatest. Greatest. What do you mean by that? So let's look at the next example. So example B, notice it has a lesion of the neck that is 1.0 by 2.0. Greatest clinical diameter of the lesion. So the greatest number between 2 and 1 is 2. So code selection is determined by the greatest clinical diameter of the lesion plus margins. And here we have 0.2 on the bottom and 0.2 on the top. So we take the 2 plus 0.2, 0.2 gives us a total of 2.4. So there's a third example, and I want you to, on your own, to go back and review that one just so that you can think through the process. So let's review excision of lesions just to make sure that we have an understanding. So first we need to know if the lesion is benign or malignant. So we need to know the type of the lesion. The second thing is that we need to know the anatomical site. Then we need to know the excised diameter. So remember, code selection is determined by the greatest clinical diameter of the lesion plus margins. We also talked about closure. Simple closure in particular was actually included in the code. Now, if they do something other than simple closure, that's actually coded separately. All right, so that's all for excision of lesions. And next up, we're going to go on to our nails. Okay, so nails takes us over to page 87 in our 2020 CPT manual, and starts off with a parenthetical note. And what you'll want to notice is the first code, 11719, is for trimming of non-dystrophic nails. And if we go on over to the next page, which is page 88, so let's pan back over to our code manual. Our next two codes are for debridement of nails by any method. And I want you to notice that the first code is for 1 to 5 nails. The next code, which is an indented code, is for 6 or more nails. So when you're coding the debridement of the nails, you need to know how many nails were actually debrided. All right, from there, we have two codes for the avulsion of the nail plate. You'll notice that the first code is for partial or complete, simple or single. And then the next code is for the additional nail plates that were removed. Now, the one thing I want to just bring up regarding when you're looking at codes, when you take a national exam such as the CPC exam, you can't have a medical dictionary with you. So it's a good idea to learn what different words mean. So for example, 11719 is for non-dystrophic nails. And those are actually normal nails with no abnormal development or changes due to aging, injury, or any type of disease. So just, taking the time to learn what the terms mean is really going to go a very long way. Now, after that, we have a code for an excision of a subungual hematoma, and then we have a code for excision of a nail and nail matrix. And here, this is for an ingrown or deformed nail, and this is for permanent removal. After that, you have biopsy of a nail unit. Then you also have a repair of the nail bed, reconstruction, and then excision of a skin of a nail fold. Now, the one thing that I do want to have you make a note somewhere here on page 88, and you could say something like, don't forget your anatomical modifiers for the fingers and toes. And you probably are like, what are you talking about? Well, when we did our introduction to the CPT manual, let's go to the inside cover. Notice here we have modifiers FA through F9 and TA through T9. So one thing about CPT coding, lots of rules, and you just have to keep pulling the concepts together to make sure that you don't forget something. All right, next up, we're going to be looking at codes 11770 through 11772. And here you have codes for a pilonidal cyst. So remember, we talked about the incision and drainage. So with pilonidal cysts, you got two treatment options. You have the incision and drainage, which we saw earlier, and then these three codes, which are for the excision. So let's pan back to our code manual. What you'll want to note here is that these codes are divided based upon simple, extensive, and complicated. And there is a parenthetical note, love those parenthetical notes, that just reminds us that, hey, if this is a incision instead of an excision, that you want to use the other set of codes. Also, again, what do these words mean? So, pilonidal cyst contains a tuft of hair that's actually developed as a result of repeated friction, which can cause those hairs to penetrate the skin. Now, typically, pilonidal cysts occur in the sacrococcygeal area. Okay, so takeaway here, is it an incision or is it an excision? All right, so after that, we're going to go to the introduction section of the manual here. And here you're going to see a couple of different options of things that can be introduced. So here you're going to see injection of lesions, you're going to see tattooing, you're going to see subcutaneous injection of filling materials such as collagen, you're going to see the insertion, removal, and replacement of tissue expanders. You're also going to see the introduction and removal of implantable contraceptive capsules, subcutaneous hormone pellet implantation, as well as the non-biodegradable delivery drug implants. And so those we have insertion, removal, and removal with reinsertion. So let's pan back over to the code manual. And these are all the things that I was just talking about. Here you'll see that we have the codes for the tissue expander, and then it continues on page 89, and then after page 89, um, the last code under introduction, 11983. All right, so the next family of codes that you're going to see here is for the um, repair or closure of a laceration. So with these codes, you'll want to think um, about what we said about excision of lesions. Remember, we had all those things we had to consider? Well, we have all of those things to consider over here as well. So we're on page 89 in the CPT manual, and the first thing that you'll want to notice is that the codes start off with some definitions. And that is because when we're coding repair, we first need to know what is the complexity of the repair. Is it simple? Is it intermediate? Or is it complex? On page 89 in your CPT manual, you actually are given the definitions of those types of complexity. Okay, and then when you go over to page 90 in the CPT manual, you'll see simple, intermediate, and complex. But just like with other codes, there are some things that we want to pay close attention to. So let's pan back over to our code manual. And so on page 90, I want you to notice under simple, we have two code families. We have the one that starts with 12001, which is for the scalp, neck, axillae, external genitalia, trunk, and extremities. And then we have the other family, which is for face, ears, eyelids, nose, lips, and or mucous membrane. So when you're coding the excision of a lesion, you have to know the complexity, simple, intermediate, and complex. Once you determine that, let's say for example, it's simple, then what you're going to do is get your body part. Then you have to know the length of the repair. Now, here is where it gets a little tricky, and I want you to pay attention to this. Notice on page 90, it's indicated that we need to code the sum of the length of repairs for each group of anatomic sites. So if you have two simple repairs of the trunk, you can actually add them up here and use one repair code. But here's the tricky part. Unlike excision of a lesions, we do not code each lesion separately. If you have a wound and wound is another name for laceration. If you have a laceration repair that is of the same complexity and that is of the same anatomic grouping, you can add them together. But let's say you had one simple of the trunk and one intermediate of the trunk. You can't add those together because in order to add them together, it has to be the same complexity and it has to be the same anatomic grouping. All right, so those are the repair codes. There are some instructional notes again that you'll want to be familiar with. The repair codes are over here on 91. You'll notice that as the repairs get more complex, you'll have more options for codes to review. All right, so then next up, our next family of codes that we have here is for the adjacent tissue transfer. And you know, the word adjacent means near or close. So adjacent tissue transfer codes start on page 92. And if you look on page 92, let's point out something that's very, very important. There's a note, and notice in my book I have it highlighted, that says codes 14000 through 14302 are used for excision and or repair by adjacent tissue transfer. So something to note here is that when you're doing an adjacent tissue transfer, the excision of the lesion is actually included in the adjacent tissue transfer. So you don't want to make the mistake and try and code the excision of the lesion of the same site as a separate code. So do not report a separate code for the excision of a lesion or another defect when you're doing the adjacent tissue transfer for that procedure. Now, according to guidelines, if the provider does the procedure to repair a secondary defect, then you can report an additional code. So again, it's all about knowing the rules. All right, after that, the next family of codes that we have here is for our skin replacement surgery procedures. And our skin graft codes are organized into the following categories. We have autograft, tissue cultured autograft, and auto means self. So this is a transplantation of a tissue from the same person. We also have acellular, we have allografts, we have different types of allografts, and then we have xenografts. Again, knowing the definitions are critical. Allograft is transplantation of tissue from someone of the same species. Xenograft, which is another option here, is the transplantation of tissue from different species. So on page 93, you're going to first see, and let's pan back over to the code manual. You're first going to see, you guessed it, some definitions. Of course, there's always definitions. And then you're going to have the codes that apply for this particular procedure. They are divided based upon square centimeters. So, just like the other codes that we've seen in this family, paying attention to details is going to be critical. All right. So next up, let's go over to we're going to go to page 97, and we're going to look at flaps. So again, another word that it's important to know what a flap is. And again, I just can't stress enough, you can't just code words. You need to know exactly what the word means that you're coding. All right, so as it relates to our flap codes, what you are going to see on page 97 are the different types of flaps, where the flaps are located, if they're doing a formation of a direct or two pedicle, which is what it starts off with on page 97. You'll also see a delay of a flap or section of the flap in 15600. Then you're going to go over into 15650. You'll notice that it's a transfer intermediate. Now, directly above that, you see a family of codes that's divided by body site. So again, it's critical to, in this particular section, what procedure was performed, and then where. Then on page 98, you have other types of skin grafts, and may not be a bad idea, guys, to perhaps write definitions of some of these flaps in the manual, because remember, if you're taking the CPC exam, you can't bring a dictionary. So now is the time for you to actually learn the terminology that's appropriate for a particular code family. All right, so we had the initial skin flap codes. Then we had on page 98, we have some more skin flap codes. And here, you're going to see different types of skin grafts, such as grafting of autologous soft tissue harvested by direct extension, which is something that's new, actually, new codes for 2020. All right, then after that, what you're going to see on page 99 are what's known as other procedures. So here with the other procedures, you got a whole bunch of different things going on. Bottom of page 99, you have dermabrasion codes. You'll notice that they're divided by what part of the face that the procedure is performed on. Then you have code 15786, and there, that is for just an abrasion. Let's pan back over to the manual. All right, so then we go over to page 100, and you're going to see all sorts of procedures again here. You're going to see a chemical peel. One is for facial, one is for non-facial. You also are going to see blepharoplasty. Now, if you'll want to note here, notice it says lower eyelid and then it says upper eyelid. So pay very close attention, and again, don't highlight the whole book, but as you're reading something, like, yeah, it's good for that to kind of pop out at me, that there's a difference between the codes for the lower lid versus the upper eyelid. Then we have codes for excessive skin, also known as a paniculectomy. This is a procedure that you'll see patients that have had weight loss surgery, that have lost lots of skin. This is a procedure that, insurance companies will pay for if it's medically necessary. After that, you have and that's code is divided by the different body parts, as you see here. So it's the arms or the abdomen. After that, at 15840, we have codes for graft of facial nerve paralysis. And then after that, we're going to have codes for removal of sutures. And what you'll notice, removal of sutures under anesthesia, removal of sutures under anesthesia. Same thing. Removal of sutures under anesthesia, removal of sutures under anesthesia. Well, what's the difference? Well, the first code is by the same surgeon and the second code is by other surgeon. Then after that, you have codes for a suction-assisted lipectomy, and they are divided by the body part. All right, after that, we're going to have our codes for our pressure ulcers. And what you'll want to note here, these codes are divided based upon where the ulcer is, as well as what they have to do with that ulcer. So for example, you'll see terminology like they had to take out the bone, they had to do a suture, they had to do a flap. So one of the things that, again, you'll notice in my book, I have underlined or highlighted things like this is coccygeal ulcer, this is sacral. And as I continue over onto page 101, you'll notice the same setup. I'm highlighting just specific things so that they can pop out for me whenever I hit that page. And one of the things that I'm highlighting here are the different body parts to make sure I assign my codes correctly. All right, the next family of codes that you're going to have on page 101 is for burns of local treatment. Now, most of the time when people talk about burns, you talk about the rule of nines. Well, in CPT world, instead of using the classic rule of nines, they use a system called the Brown-Lauder system. It's actually on page 102 in your code manual, very similar to the rule of nines. All right, as it relates to code options, we have codes for initial treatment, we have codes for dressing and the debridement. What you'll want to note there, those codes are divided by the percentage of the total body surface area. So you want to pay close attention to those. And then we have two codes for eschrotomy, which are divided into initial incision and each additional incision. All right, so guys, we're almost done with this. Next up, we have our destruction codes. And you want to be very careful with the destruction codes. And we're going to go over to page 103. So, what is destruction? Well, destruction is where the doctor is going to do an ablation of tissue by any method. And during the dissection or destruction procedure, excision, incision, removal, repair, closure procedures, those may be necessary to actually do the procedure. And we don't want to code debridement when the intended procedure is performed during the same operative session. And you're going to see something as a trend like that throughout the CPT manual. If another procedure is inherent in a procedure, we're told not to code it separately. So we're going to start with codes 17000. I want you to notice that this destruction specifically says benign or pre-malignant lesions. So we start off with these first two codes. The first code is for the first lesion, so that's one lesion. And then notice the add-on code of 17003 is for second through 14 lesions each. So you have a code for each lesion up to 14. Now, if you go higher than that, you'll want to note that we have code 17004, and that code in particular is going to be for 15 or more lesions. And you cannot report 17004 in conjunction with 17000 through 17003. How do I know that? There's a parenthetical note. After that, we have destruction of cutaneous vascular proliferative lesion. What you'll want to note here is that these codes are divided based upon the square centimeters. Then after that, 17110, bottom of page 103, we have destruction of benign lesions other than skin tag or cutaneous vascular proliferative lesion. First code up to 14 lesions. The second code is for 15 or more lesions. Now, of note, on the next page, page 104, we have codes for destruction of malignant lesion. Now, that word malignant, you heard that before. That was under excision of a lesion, malignant lesion. With destruction, it's gone. You don't have anything else to, you know, the area that was destroyed is gone. All right, so as it relates to the malignant codes, the first thing you need to know is your body part. So you'll notice here again in my book, I have the main body part areas highlighted. And again, that's so I'm able to differentiate among them as soon as I hit the page. Okay, I need to make sure that I know what my body part is, then I can get my size and I can have correct code assignment. Now notice it says lesion, so if they do more than one lesion, you can have more than one code. You don't add them together. All right, next up, we have a procedure called Mohs micrographic surgery. And with Mohs micrographic surgery, this is when the physician is acting as a surgeon and a pathologist. And his goal is to get rid of all of that bad tissue prior to, the the conclusion of the procedure. So we're going to look at codes on page 104 in the CPT manual. And what you're going to notice here, code 17311, this is for specific body parts for the Mohs micrographic surgery. So a couple of things to note. 17311 says head, neck, hands, feet, genitalia. All right, and it includes with surgery directly involving muscle, cartilage, bone, tendon, major nerves, or vessel. I also want you to note that this particular code says first stage up to 5 tissue blocks. So this code includes the first stage of the procedure up to 5 tissue blocks. That number will actually be documented in the record, so you'll know how to coded accordingly. Then 17312, this is an add-on code, and notice this is for each additional stage after the first stage. So if you got 3 stages, here's where you're going to get the add-on code for each additional stage. Now you have something similar in code 17313. in that this is the first stage. This is for 5 tissue blocks, but the body parts are different. So here we have trunk, arms, and legs. And again, we have an add-on code for each additional stage beyond the first stage. Now notice both of those say up to 5 blocks. Well, what happens if you have to do more than 5 blocks? We have an add-on code for each additional block after the first 5 blocks any stage. So really, guys, documentation is going to drive code assignment here, and it's really going to be based upon what's actually documented in the medical record. All right, so the last part of this section that I want to talk about is going to be the procedures on the breast. Now, as it relates to procedures on the breast, you'll want to remember that we previously saw a fine needle aspiration. That is coded where? The very beginning of this section. Here, we start off with a puncture aspiration code on page 105, that's 19000. You'll notice that the first code is for the first cyst, the second code is for each additional cyst. Then 19020, 19030, additional procedures that can be performed, such as a mastotomy and an injection procedure. Now, here is where the fun begins. So on page 106, and let's pan back over to the CPT manual. I want you to note, and again, notice I got some highlighting going on. 19081, this is a breast biopsy with placement of a localization device, and it is for the first lesion with guidance, specifically stereotactic guidance. This is very important because if you notice, when you get to 19083, it's the same procedure, but it's ultrasound guidance. And then when you go down to 19085, this is same procedure with MR guidance. Again, this is a biopsy of the breast with placement of a localization device, and they're divided based upon the type of guidance that's actually used. And the setup here with the codes, the first code is for the first lesion, the add-on code is for each additional lesion. Then we have 19100, and this particular code here, what I want you to know about this code, this is a breast biopsy, percutaneous needle core, not fine needle. No imaging guidance is done here. Now, the indented code underneath there is also a biopsy of the breast, but it's open incisional. And then still here, guys, what you want to note, no imaging guidance performed. After that, you'll see a couple of other procedures such as excision of a lactiferous duct fistula. 19120, we have excision of a cyst, fibroadenoma, or other benign or malignant tissue. And then we have codes that are called introduction on page 107. Now, you want to be very careful here because these codes look different to codes that we just saw, but let's look at the difference. So these codes are not biopsy codes. They are only for placement of a breast localization device. So there's no biopsy. If there's a biopsy with the placement of the localization device, you're going to look at those codes that we saw previously, okay? Very, very important. Now, these codes are divided based upon the type of imaging guidance. So 19281, mammographic guidance, 19283, stereotactic, 19285, let's pan over here, ultrasound guidance. 19287 is magnetic resonance guidance. Same setup. First code is for the first lesion. Each additional code is that add-on code. But again, here, guys, the code's on 107. They're not doing a biopsy. They're just doing the placement of the localization device. All right, and then the next part of this particular area guys, you have your mastectomy procedures, which are on page 108. They are divided based upon the type of mastectomy that was done. So basically, how much did they actually take out? Again, you'll notice in my book, I have certain things highlighted. So 19301, this is for mastectomy partial. 19303, mastectomy simple complete. 19305, mastectomy radical. So again, attention to detail is going to be critical here. And then the last two areas here, we have repair and or reconstruction breast procedures, very common after a patient has had a mastectomy. So it's different types of reconstruction that the patient can have. And then the last code in this code family is going to be 19499, and this is again family all by itself, but it is for an unlisted procedure on the breast. And this is only used in very rare circumstances. One reason is that there is no value for this particular code. The insurance company is going to make a determination as to how much they're going to pay for this procedure on a case by case basis. All right, guys, so that was your introduction to the 10,000 integumentary system. Don't forget to follow us on social media at Facebook, Twitter, Instagram, LinkedIn, and Dr. Campbell's Coding and CDI Corner. Thank you so much for listening and have a great day.